नमस्कार, मैं डॉक्टर लोकेश भाटिया स्वागत करता हूं आपका लोक टॉक्स चैनल पर। साथियों, आज चर्चा करेंगे लो बैक पेन, कमर में होने वाले दर्द के सिलसिले में। और इससे पहले भी मैं कई सारे वीडियोस बना चुका हूं और आज जो है ये कमर का जो हिस्सा है, यहाँ से नीचे पैरों में जाने वाला दर्द, उसके बारे में हम चर्चा करेंगे, जो अक्सर एक डिस्क नामक तकलीफ के कारण होता है। इस प्रकार से हम इसको जानते हैं। डियर फ्रेंड्स, आइए आज चर्चा करते हैं जो इसको कॉमनली आप सब लोग जानते हैं शाइटिका के नाम से। आइए चर्चा करते हैं। टुडे आई विल बी टॉकिंग टू यू अबाउट लो बैक पेन with radiating pain down lower limbs, either one side or both sides, and that is invariably because of acute prolapse, herniation or extrusion of disc in this lumbar area. Stay tuned till last. You will get a lot of insights in this video, a lot of educational material you will find in this video today.
Namaskar, welcome to Lok Talks. Thank you very much for subscribing to this channel for professional medical guidance, spirituality and meditation and life coaching. Here is my WhatsApp number. Do connect me in person if you have any question. Thank you.
Right. So we will discuss this topic in question answer session because I've decided some FAQs, frequently asked questions relating to this topic, we will be considering one by one. So the first question is, what is disc problem and how does it present? As I said earlier, the disc is the pain in the lower back region and the pain going down in one or both the lower limbs. More importantly, pain going below the knee right up to the foot, that holds significance as far as the disc problem is concerned. Invariably, the history is that the pain in the back precedes the pain radiating both lower limbs, one or both the lower limbs. So, unless the pain is radiating down the lower limbs, if you are not having pain going down the lower limbs, you need not to consider, you need not to think that it is a disc problem. Let this point be very clear at this stage itself, right? Okay. Now, let's understand what is disc problem. How does it present? I have discussed that. Now, what is it? Let me explain you with this model. These are the vertebrae and these are the intervertebral discs. Now, let me handle this disc, just a model to make you understand what I'm trying to convey you. This is the disc like this, and this reddish area is in the central part. The surrounding part is called annulus fibrosus, and this reddish part actually is supposed to be in the center. It is a gelatinous part. Whenever there is a tear in the annulus fibrosus, this will walk out of its place and will appear like this. And whenever this situation happens, you can see this, you can observe this model. This is how this is extruded disc and is compressing on the nerve roots, and this is how you start getting pain in the lower limbs. So this is how it will be presenting. Invariably, it can happen that the pain in the back was for some couple of weeks time or a week's time, then suddenly started getting sharp shooting pain in both the lower limbs or one of the limbs. So this is how normally it presents, right? So first thing which should strike to your mind in case of your radiating pain only, that it might be a disc problem. Next question comes is, what is the commonest age group, right, which can have a disc problem? 16 years to 50 years is the age when one should consider a possibility of disc problem. Why not after 50 years of age? Because as one ages, this particular disc is no more gelatinous. As I said, this gelatinous disc will walk out because of the rent which gets developed in the annulus fibrosus and will start compressing with these. So this kind of situation can happen only in the young age group. Younger age group means 16 years to 50 years of age is the age when we come across very common presentation with low back pain with radiating down the lower limb or limbs, right? So now the next question comes is it a permanent diagnosis? Yeah, this is very important, very frequently being asked in day-to-day clinic, as this is very common problem. Every day I keep seeing 3 to 5 patients in my clinic every day. So this is one such common question which the people keep asking and people keep mentioning in their past history also, that 5 years back I had a disc problem. Then they are saying that they have only a localized pain in their back, and then they are trying to convey that this is again a disc problem. So let me make things again very clear. Unless the pain is radiating down the lower limbs, unless the pain because of the compression here, unless the pain is going down the lower limbs, you should not consider, you should not think about disc problem. That was a history and that has healed, that's the past. Definitely it is worth mentioning, but many times nowadays in this Google era, people go through Google a lot and try to misguide, try to give a mishistory to the treating doctor, which is again not a good practice. So to understand this particular topic, this particular scenario, we need to know that this sharp shooting pain going down the lower limbs, unless that complaint is there, every localized low back pain is not a disc problem, right? So we are clear up to this, that this is not a permanent diagnosis. It may recur, but the presentation should be similar what was there as earlier experience of yours. Then next comes, if you are at home and you want to make out, you haven't yet consulted a doctor, orthopedic surgeon or a spinal surgeon, you haven't yet consulted, and if you want to get some clue whether you have a disc problem or not, so very elementary idea, you can get it by lying down flat on your back with the knee keeping straight position. When you keep your knee straight and your sharp shooting pain going in the lower limbs increases. Well, let me make one point very clear here, that all mechanical back pain once you lie down should get reduced. Mechanical back pain gets reduced by lying down, and the medical back pain remains same, or maybe some rheumatological conditions may increase in the lying down position. That's one distinguishing feature of mechanical back pain and medical back pain. This particular point I have discussed in a very elaborate manner in the previous videos. The relevance of this particular point here in this topic is that if you are getting sharp shooting pain and lying down on your back and keeping the knee joint straight, an extended position I mean, and when you flex your knees, keeping a couple of pillows below the knee or bending the knee, and you get your relief in pain, that gives you a clue that yes, you may have a disc problem. Another important sign which you can also make out, try to walk on your heels, and if you find your toe is not going up, if you find your foot is not going up, if you find that you are not clearly able to keep and walk comfortably, or toe is getting down, that is very indicative and that is not a good sign in fact. Walk on the toes. If you are able to walk with 2 inches high at least, taking full weight on the toes, that's a good sign that you are able to walk on the toes. But eventually if you are not able to walk on the toes, or eventually if you are not able to walk on the heels, that's not a good sign. You must report to a spinal surgeon, to an orthopedic surgeon who does spine surgeries. You must consult an orthopedic surgeon, right?
Welcome into the next question, that what diet patients should be taking. This is another very common question. People keep asking me what diet is recommended for the patients with disc or low back pain problems. As such, there is no special recommendation. But yes, preferably a diet which doesn't increases your body weight, which doesn't allows you to become obese, which doesn't increases your body weight. Keep yourself physically active, mentally relaxed, and eat more fibrous diet. This is the most important point to be understood and practiced on day-to-day basis. Make sure that you are not becoming bellied, you are not gaining weight, so that the pressure on the spine will not increase, and in future you will not develop further problems in the spine. What exercises should be done for this problem? As such, Surya Namaskar is a fantastic exercise for this patients. Spinal extension is excellent exercises. And what should not be done? I am showing it to you by these animations. These exercises should not be done. It may aggravate your problem. What kind of mattress they should be using? The disc patients or low back pain patients many times come with assumption, or they have kind of a myth that they should be sleeping on hard bed, tabletop hard kind of beds they are sleeping, or they sleep on the floors. Well, as such, there is no such evidence of it. Yes, what mattress you need to have is a firm mattress. It should not be very soft, it should not be very hard. So this is what has to be understood, right?
Now next question comes is, which patients among disc problems are, as I said earlier, the extruded disc is one, that is of course an imaging finding, right? If the MRI indicates that there is a extruded disc. But are there any absolute indications for surgery? Yes, there are two absolute indications for surgery. The rest all are relative indications for surgery, and that varies from surgeon's choice, and that can vary from what I am stating you now. So if we see extruded or sequestrated disc in MRI, and the MRI report also reveals the same extruded or sequestrated disc, this patient stands a great chances to go for surgery. So the point here to understand about absolute indication means if you have these two things, you definitely need surgery. Number one, you may develop sudden bladder bowel control gets lost. That's an emergency situation. That's a red flag. You need to know it and you need to rush to a surgical center. Second, you did consult your doctor, you got the diagnosis as a disc problem, and suddenly you realize that you are not able to walk on the heel, or you are not able to walk on the toes. That means there is sudden deterioration in the neurology, and with these two problems you need not to delay at all. Consult the orthopedic surgeon as early as possible with all the preparations to go for surgery. So these are important things to be aware about, and I'm sure these tips will definitely help you to take care of your problems with this in lumbar region. Yes, what is the position if you have a disc problem or acute lumbago? As I have said earlier also, in the mechanical back pain there are four entities. One is acute lumbago, that is the lumbosacral strain. Two, prolapsed antevertebral disc, the topic what we are discussing today. Third is lumbar canal stenosis, maybe next time I will talk about this. Fourth is spondylolisthesis or a unstable spine. So out of these four entities, the most common after acute lumbago or lumbosacral strain is this disc problem. If the age group is 16 to 50 years of age, one should consider, with sharp shooting lower limb pain, one should consider the highest possibility. The first commonest reason stands out is acute lumbar disc prolapse. Now let's understand three important terms here. One is disc bulge. Bulge is only seen in MRI. Bulge will not give rise to much of symptomatology. Symptoms, if they are there, it is definitely a little higher grade than bulging. What are the different grades? These are talking about the radiological grades. Bulging, herniation, protrusion and extrusion. I'll be putting up in bullet points. bulging, herniation, protrusion and extrusion. Now, out of all these four, which one stands the higher possibility to go for operation? It is the extrusion. If your MRI report mentions a word extruded disc, you stand little higher possibility to go for operation. Another commonest question patients are very curious to know is, if I have a disc problem, doctor, as you said, then do I need to go for surgery? So answer to this question is 80 to 90% of patients do resolve over a period of 3 to 6 months time. 6 months of skilled conservative treatment is good enough, and 90% of patients will resolve conservatively. Means they will not be requiring any operative management. Of course, if the patient do not have much of patience and there are some job constraints and there are now endoscopic surgical options also available, where not long duration of surgery is required, where the very small incision and minimal morbidity, minimal hospitalization time and quick recovery is possible, and patient can join their job very early than the conventional surgical teams. As such, if you compare the long-term, like 2 years results, the result-wise, the conservative management, operative management-wise, things do not differ too much. But yes, in terms of early joining their jobs, in terms of shorter hospitalization stay, in terms of quickly able to resume their original job status, they are definitely much faster recovery happens with endoscopic or surgical treatment. Lastly, one question: if you are diagnosed with acute lumbago or if you are diagnosed with lumbar disc prolapse, then what position will help you to recover faster? When you are sleeping on your back, make sure that you are placing a couple of pillows below the knee, so that you are keeping your thighs little bit 30 degrees in flexion and knees also 30 to 40 degrees in flexion. When you are sleeping on your sides, place a pillow in between both the knees or thighs. This position helps to relax your lumbar muscles, and lesser pain you will experience in this position. And till you have symptoms of radiculopathy, the pain radiating down in the lower limbs, you can definitely make a practice to lie down in this position. Even if you want, your job is of prolonged standing every day, then definitely while lying down, while sleeping, you can practice this position on a regular basis also. As such, this position is called semi-formless position. Alright, thank you very much. So this is all for this today's video. If you have any more questions for back pain or any of this, this is what relevant questions, what the frequently asked questions I could figure out to answer in this video. If you have any more questions, feel free to connect me. Feel free to ask in comments, or you can connect to my WhatsApp number also. I can guide you definitely, and advisory can be definitely even online as well. If you have all the workups done, if your MRI has been done, you can definitely decide what you best need as a part of your treatment. Thank you very much. Thanks for listening to this. Thank you. Bye-bye. See you in the next video. Do share it with all your friends, all those who back pain and this kind of this problem. A lot of young people keep suffering, keep facing. Definitely this will be of great help to your friends and relatives as well. Make sure that you are sharing with them. Do subscribe to your talks and don't forget to hit the bell icon. Thank you very much. Bye-bye.